Welcome back to the deep dive. We're here again to unpack complex topics and really pull out the key insights for you. Today, we are zeroing in on something really critical. It's a life threatening challenge, actually, for some of the most vulnerable animals out there newborn calves.
Yeah, this deep dive is all about two conditions that are, well, they're intimately linked. Neonatal septicemia and failure passive transfer, or FPT as it's often called. Our mission today, it's really to uncover the connection between these two, understand their sort of hidden impact, and most importantly, explore how we can safeguard these tiny animals right from the moment they're born. And even if farming isn't your world, this discussion has some fascinating takeaways about basic immunity, how fast disease can spread, and the incredible power of that first milk. So let's get started.
Okay, let's unpack this then. When we say calf septicemia and failure of passive transfer, what exactly are we talking about? So, neonatal septicemia, that's basically a life-threatening infection that goes systemic, affects the whole body in newborn calves. It's usually caused by bacteria, often common ones found right in their environment, like E. coli or Salmonella. And these nasty bugs can get into the calf system in a few ways, right? Through the gut, breathing them in, the umbilical cord, even just a small break in the skin. And then there's failure of passive transfer, FPT. This happens when the calf just doesn't absorb enough antibodies from its mother's colostrum, that really vital first milk. And here's the part that always gets me. Calves are born essentially without any circulating antibodies. Zero. They are completely reliant on getting them after birth. Their immune system is basically offline at the start.
It's truly fascinating, and you've hit on the key point, how incredibly linked these two are. FPT isn't just, a risk factor for septicemia. It's the primary predisposing
Yeah.
factor. And the reason why is quite unique to cattle. They have what I call an epitheliochorial placenta.
That's a mouthful.
It is.
Yeah.
But what it means essentially is that the structure prevents mom's antibodies from crossing over to the calf during pregnancy, unlike in humans, for instance. So they really are born completely immunologically naive. Defenseless, you could say. If they miss that first critical dose of antibodies, they're wide open to infection.
Right. So colostrum, that first milk, isn't just helpful. It's quite literally the calf's only source of immediate life-saving immune protection at birth. But is it just about the antibodies, or is there more going on in that colostrum?
That's a great question. Because, no, it's definitely not just antibodies. It's a really complex biological fluid. Of course, the immunoglobulins, the antibodies, especially IgG, which makes up 85–90%, they're absolutely critical for that immediate broad protection. But colostrum is also packed with other things. Think of it like a holistic primer for life. It's got growth factors, hormones, cytokines, plus essential macro and micronutrients.
So it's like an all-in-one starter kit.
Exactly. It's everything that newborn needs for a healthy kickstart,
Yeah.
setting up not just immunity, but metabolism and gut development, too.
And here's the crucial time element, the kicker, really.
Yeah.
The calf's gut can only absorb these big antibody molecules right after birth. This ability, this permeability, it drops off fast, really fast. After just 6 to 12 hours, it's declining significantly.
Right.
And by about 24 hours, absorption pretty much stops completely. We call it gut closure.
That's right. It's an incredibly tight window.
So even delaying that first feeding by a few hours could make a massive difference.
A huge difference. It can seriously undermine that foundational immunity. They basically miss their one shot at getting that instant passive protection absorbed effectively. And if we connect this to the bigger picture, the consequences of FPT go way beyond just getting sick right away. The data shows it significantly increases long-term risks. We're talking about doubling the risk of mortality overall.
Doubling. Oh.
Yeah, and nearly doubling the risk of serious respiratory disease down the line, plus a big jump in the risk for diarrhea and just general illness. From an economic standpoint, for farmers, this is it's a hidden drain. Estimates put the cost at around €60 per dairy calf and maybe €80 per beef calf that suffers from FPT.
That adds up fast across a herd.
It really does. So managing colostrum properly isn't just about avoiding a sick calf in week one. It's a fundamental investment in that animal's future, its economic viability, and the whole herd's productivity.
Okay, so we've established how vital that initial immunity is. But what happens when it fails? When FPT occurs and these calves are left vulnerable, how do infections like septicemia actually take hold? And crucially, What does it look like? How would you even know? Well, it often plays out like a frightening domino effect. The bacteria usually get into the bloodstream by exploiting some other weakness, maybe a localized infection first. Common entry points are the umbilical stump that can lead to what's called navel ill, or maybe they ingest bacteria from contaminated bedding or feed or even inhale pathogens.
So it starts somewhere specific, but then it spreads.
Exactly. Once those bacteria breach the defenses and get into the bloodstream, they go systemic. That triggers this massive, overwhelming inflammatory response throughout the entire body.
And that's the septicemia itself.
That's a septicemia, and it can spiral downwards very quickly, leading to multi-organ dysfunction, shock, and often, unfortunately, death. Complications like lactic acidosis are pretty common too.
And the signs, are they obvious?
That's the tricky part. Early signs can be incredibly subtle, really nonspecific. The calf might just seem a bit down, weak, maybe not wanting to nurse as eagerly, things you could easily miss or put down to something else.
That sounds difficult to catch early then.
Very. Now, acute septicemia, that typically hits calves in the first week, maybe days 2 to 7. It comes on fast and it's often fatal. Signs there might include a fever, or sometimes actually the opposite, hypothermia, a dangerously low body temperature. Also, a really fast heart rate, rapid breathing, and sometimes you see tiny red spots, petechial hemorrhages on the gums or skin.
Okay.
Then there's less acute or chronic septicemia, usually in slightly older calves, say 7 to 28 days. These cases might seem milder initially, and they're often linked to localized infections settling somewhere specific, like in the joints causing arthritis or in the eyes or even meningitis.
So it can present in different ways depending on the age and severity.
Precisely. And this hidden burden, the fact that it can come on so suddenly and progress so rapidly, often without obvious warning signs beforehand, means septicemia's true impact on calf mortality is likely underestimated. I saw one study, for instance, that found over a third, 34.3% of critically ill calves actually had sepsis.
A third? That's high.
It is, and the mortality rate among those septic calves, a staggering 61.3%. Many of those deaths might just get recorded as general calf mortality without pinpointing septicemia.
Wow. Okay, this raises a really critical question then. If the signs are often subtle and the disease progresses so fast, how on earth can we diagnose it effectively when time is clearly everything? You mentioned blood cultures earlier, but the challenge there is the turnaround time, right? 48 to 72 hours.
Exactly. That's the gold standard for confirming bacteria in the blood. But it's often just too slow for guiding treatment when a calf is crashing. You need answers much faster.
Which means we absolutely need a more strategic diagnostic approach, especially on the farm.
Totally. So what is that strategy when time is absolutely critical? How do we figure out FPT and potential septicemia quickly? Well, for FPT, you're trying to assess their immune status. We can measure the actual antibody levels, the IgG, in their blood serum. Below 10 milligml usually signals FPT. Or, a simpler proxy is measuring serum total protein. If that's low, say below 5.5 GDL, it strongly suggests FPT. These can give you a quick indication of risk.
Okay, so that checks their initial protection level. What about diagnosing the active septicemia?
Right. Blood culture is definitive but slow, as we said. A complete blood count, or CDC, can give clues you might see very low or very high white blood cell counts, or immature cells indicating infection. Serum chemistry panels can also help, looking for signs of metabolic acidosis or organ damage.
Those still require lab work, mostly.
Many do. But this is where some newer tools are really making a difference on farm, things like sepsis scoring systems. There's one model, the CSSB, that looks for an abnormal mental state combined with at least 2 signs of systemic inflammatory response syndrome, SIRS criteria.
SIRS criteria being like abnormal temperature, heart rate, breathing.
Exactly. Abnormal temperature, heart rate, breathing frequency, or even the color of their gums or mucous membranes. These scoring systems are proving quite sensitive. One study showed 84% sensitivity, and they're practical for quick assessment right there in the barn.
Ah, I see. So it's sort of a two-tiered approach then.
Precisely.
You use these rapid, sensitive on-farm screening tools like the scoring system or maybe quick protein check to get a presumptive diagnosis.
Yes, enough to act on.
And based on that, you start immediate empirical treatment, meaning you treat based on the strong suspicion, using broad approaches because waiting isn't an option. And then in parallel, you still send off samples for the slower, more specific lab tests, the culture, the susceptibility testing, to get that definitive diagnosis and fine-tune the treatment if needed later.
Exactly. You can't afford to wait for definitive results when the clock is ticking that fast.
Makes sense. So once you have that presumptive diagnosis and you decide to act, What does this aggressive multimodal treatment actually involve? You made it sound pretty intense.
It is intense, and it really needs to be, because septicemia, frankly, carries a grave prognosis. The outlook is often poor. Success, if it comes, almost always depends on recognizing it early and instituting really aggressive medical therapy immediately. A wait-and-see or minimalistic approach just doesn't work here.
So what does that therapy look like?
First off, broad-spectrum antibiotics given promptly, often intravenously, IV, to get high levels into the bloodstream quickly. Think drugs like ceftiofur, ampicillin, maybe fluoroquinolones, depending on the situation and local regulations.
Okay, antibiotics are key. What else?
Just as vital is supportive care. This isn't optional, it's crucial. Intravenous fluids are essential to combat the severe dehydration and metabolic acidosis that often develops. We also use nonsteroidal anti-inflammatory drugs, NSAIDs, to manage pain and dampen that excessive inflammation. And nutritional support is critical too. If the calf won't or can't nurse, they need energy. That might mean tube feeding or even intravenous nutrition in severe cases.
Right, keeping their strength up. And what about treating the underlying FPT if that's diagnosed too?
Good point. If FPT is confirmed, treatment might involve a plasma transfusion to provide antibodies directly into the blood. Or if the calf is still very young, under 12 hours maybe, an oral colostrum transfusion or supplement might still be absorbed. If they're older, it usually has to be IV plasma.
So when you say multimodal, you really mean hitting it from all angles: infection, dehydration, inflammation, nutrition, and the underlying immune failure.
Exactly. It's not a silver bullet situation where one drug fixes everything.
No, definitely not. A single therapy just isn't enough. That comprehensive supportive care is absolutely vital to try and stabilize the calf and counteract that systemic meltdown. But it's important to stress, this is a complex, it's costly, and it's a very resource-intensive effort. And even with all that, the outcome is uncertain.
Yeah.
Which honestly just brings us back full circle, doesn't it? It really underscores why prevention is just so incredibly critical. Trying to treat septicemia is a tough uphill battle. Avoiding it in the first place is where the real win is.
Absolutely. So let's shift gears to that then. Prevention. What does this all mean for stopping this devastating double threat? How do we give these vulnerable calves the absolute best start?
Well, it really hinges on optimizing that colostrum management. It's the cornerstone. People often talk about the 5 Qs of colostrum, which is a great framework.
The 5 Qs. Okay, let's break those down. What's the first Q?
First is quality. You need to ensure the colostrum actually contains enough antibodies. We aim for at least 50 grams per liter of IgG. You can test this using tools like a Brix refractometer, looking for a reading of 22% or higher, or other testers. High bacterial contamination also lowers quality, so cleanliness is key even here.
Right, because if the quality isn't there, it doesn't matter how much you feed, does it?
Precisely. Poor quality colostrum just won't provide adequate protection.
Okay, quality. What's next?
Second Q is quantity. Calves need a significant volume of this good quality colostrum. The general guideline is at least 4 liters, or about 10% of their body weight, within the first 4 to 6 hours of life.
4 liters is quite a lot.
It is. It's a substantial meal designed to flood their system. And ideally, they should get another feed, maybe 2 liters, within the next 12 hours. The overall goal is to deliver somewhere between 150 to 200 grams of IgG total.
Got it. Quality, quantity. What's the third Q?
Third, and absolutely critical, is quickly. As we discussed with gut closure, that clock starts ticking immediately at birth. You need to get that first feeding of colostrum into the calf as soon as possible. Ideally within 1 to 2 hours, absolutely no later than 6 hours. Every hour you wait, the efficiency of absorption drops.
Time is truly of the essence there. Okay, Q number 4.
Number 4 is squeaky clean. Hygiene is paramount through the whole process. Collection of the colostrum, storage, whether you refrigerate it for up to 24 hours or freeze it properly, often flat in bags, for longer storage, and the feeding equipment itself. If the colostrum or the bottle is dirty, you risk introducing harmful bacteria right along with the antibodies, potentially canceling out the benefit or even causing illness. Some farms even pasteurize colostrum to reduce bacterial load, though it needs careful temperature control.
Makes sense. Cleanliness avoids introducing the very problem you're trying to prevent. And the last Q.
The 5th Q is quantify. This means monitoring your program to see if it's actually working. Are your calves achieving successful passive transfer? You can do this by routinely checking blood samples from a percentage of calves a day or 2 after birth. looking for adequate serum total protein levels, like over 5.5 GDL, or serum IgG levels.
So you measure to manage. You need to know if your efforts are paying off.
Exactly. It closes the loop and helps you identify if you need to adjust your protocols for quality, quantity, or timing.
Okay, those 5 Qs cover colostrum really well, but prevention isn't just about the first milk, right? What else is crucial?
Absolutely. Environmental hygiene and biosecurity are huge. You need clean, dry calving areas. Minimizing the calf's exposure to pathogens right from the start is critical. Disinfecting the umbilical cord, the navel, immediately after birth is also vital. Using a 7% iodine tincture is generally considered the gold standard. It helps dry out the cord and kill bacteria, sealing off that potential entry point for infection.
Good navel dipping. Got it.
And then general biosecurity. Things like strict traffic control between different groups of animals, proper cleaning and disinfection of feeding equipment, boots, anything that could transfer fecal matter and pathogens. Preventing that fecal-oral contamination route is key.
Right, keeping things clean overall. What about things like feed?
That's another important factor, particularly mycotoxins. These are toxins produced by molds that can contaminate feedstuffs. Mycotoxins can have a really detrimental effect on the immune system, even at low levels. If a calf is already borderline on immunity due to slightly suboptimal colostrum intake, exposure to mycotoxins can push them over the edge, making them much more susceptible to infections like septicemia.
So it's like a double hit to their defenses.
Exactly, it's a synergistic effect. So managing mycotoxin risk across the entire feed chain, from harvest to storage to feeding, is really important. That involves good storage practices and often testing feed using sensitive methods like LC-MSMS.
Okay, so clean environment, clean feed. What about the dam, the mother cow herself?
Her health is crucial too. Firstly, vaccinating the dam before calving can significantly boost the levels of specific antibodies in her colostrum against common calf foot diseases like rotavirus, coronavirus, or E. coli. This provides targeted protection for the calf.
Ah, so you're essentially vaccinating the calf via the mother's colostrum.
In effect, yes. And secondly, the dam's overall health, her nutritional status, her body condition, all these influence both the quality and the quantity of the colostrum she produces. A healthy, well-nourished cow is more likely to produce high-quality colostrum in sufficient amounts.
It really is a multi-pronged approach then. Colostrum management, hygiene, feed quality, dam, health, everything working together.
It has to be. There's no single magic bullet for prevention, just like there isn't for treatment. It requires attention to detail across the board.
Wow, what an incredibly detailed deep dive that was into calf septicemia and failure of passive transfer. We've really seen how these two are just critically intertwined, haven't we? And how missing out on that essential first milk creates this huge vulnerability for newborns. It really turns their first few hours and days into a high-stakes race against time.
That's absolutely right.
Yeah.
And while, we talked about the aggressive treatments needed for calves that do get septicemia, it's clear that's often a really challenging, uncertain, and costly battle. It makes you appreciate just how much is riding on getting those first few hours of life right. The most impactful strategies, without a doubt, lie in prevention. That meticulous focus on colostrum, the 5 Qs, combined with stringent hygiene and managing those other stressors like mycotoxins.
Yeah.
It's not just about preventing one specific disease. It's truly a holistic investment in that animal's entire future, their long-term health, their productivity.
Yeah.
It sets the foundation.
So, thinking about all this, what does it mean for you, listening in? Considering how utterly dependent these calves are on that first milk for their foundational immunity, it makes you wonder, doesn't it? What other fundamental biological processes right at the beginning of life might have such profound, long-lasting impacts on overall health and productivity, not just in animals, perhaps, but maybe in humans too? Something to mull over until our next deep dive.